Welcome back to Heart Health Lives in the Balance. I want to wrap up with a focus on the treatment of pericarditis when it comes to recurrent cases. There was promising new research on biologic drugs, some even calling it a game changer, and how we treat this condition. I want to bring everyone back in for this conversation. Dr. Lewinter, let me start things off with you and talking about the classic treatment, which is the treatment that I've been on, right? NSAIDs, high-dose Motrin, colchicine as well. Talk me through that first.
Right. Well, just to do a little bit of history, 40 years ago, if you came to me, I would have said, well, take some ibuprofen and go away. That's it. I can't do it. So the standard initial treatment for a first episode of pericarditis is a combination of an NSAID, and most commonly it's ibuprofen. So that plus a drug called colchicine, which has been around forever, and that combination generally will control an initial episode, and has been mentioned, for most people, that's it. However, for patients who are more difficult, especially when they begin to have multiple recurrences, sometimes colchicine and NSAID will not control things, and then the usual next step, or has been in the past, the usual next step is addition of prednisone, corticosteroids. And that gets into a mess because it's very difficult to manage this. Patients go up and down with recurrences, and sometimes prednisone can actually encourage recurrences. So it's, once you're down that path, it's a problem. So that's why these newer biologics have been such a big contribution.
So, Dr. Cloud, I want you to jump in here, right? Because we have kind of this breakthrough treatment, which both of these women have been on, rilonacept and anakinra. These are both biologic drugs, which are really changing the game when it comes to treatment of pericarditis. Talk to me about this and how it's actually working with our systems.
Okay, so I was very fortunate to lead the study called the Rhapsody trial, which is about a biologic IL-1 receptor blocker, a trap, called rilonacept. And rilonacept and other drugs, anakinra, are really game changers. So there's a paradigm shift. As Dr. Lewinter mentioned, you went with NSAIDs, colchicine, exercise restriction, and then you went to steroids. But now we're bypassing the steroids and we're going right to these biologics. So, my two patients over here have been on biologics, and that's really a game changer. So it allows you to wean off the steroids, which have tremendous side effects, weight gain, ulcers, osteoporosis.
Talk about exercise restriction. That was a tough one for me in my recovery, but you really couldn't get your heart rate over 100 in order to heal. Where are we on exercise right now, especially with these biologics?
Okay, Yasmin, so the biggest fight in the office with patients is about, can I exercise? And we know that exercise is a pro-inflammatory state. If you imagine the lining is very raw and you go for the run, a faster heart rate, you're increasing the friction in the lining of the heart. So you have to let things heal. Guidelines out there recommend between 1 and 3 months you should sort of cool it. I've been very conservative, telling patients to walk your dog, keep your heart rate less than 100 to let things heal, gradually taper your medicines, and then you...
Unless you have a puppy who's running you around, in which case your heart rate is definitely getting over 100. Dawn, that must have been really difficult for you. If it was hard for me, it must have been so difficult for you to have that exercise restriction. How did you manage that psychologically?
I tested it. You know, you get your heart rate up to 100, but that part was really, really, really difficult. But again, I wanted to heal. I wanted to be over so I could connect the days of being able to exercise. So I just sucked it up.
You sucked it up. Meditation, yoga?
Yoga, breathing, meditation were, I didn't do it until the end of my pericarditis, like in my 3rd year. That's when I started doing the yoga, because I never thought about it. Somebody came to me and introduced me to it, and I really think it expedited the symptoms and my healing.
What is your message, Carol Ann, for folks that might be watching us and saying, oh my gosh, do I have this? Or how do I get through this? Is there a light at the end of the tunnel?
I think for me, the message to put out there is trust yourself and become your own best advocate, because you don't want to get it fast, you want to get it right. And so finding the right care and not giving up until you feel in your intuition that you're on the right path.
Thank you guys for sharing your story. I know it's hard to be personal like this on national television, but obviously it's incredibly important to you, having had it change your life, and it's changed my life. And I want to make sure other people aren't misdiagnosed or treated wrongly as we were. So thank you too. And thank you guys for sharing your expertise with this situation. It'll help a lot of folks out there. I know it will. So thank you for that.
Thank you.
And thank you for watching this Heart Health special. My hope is that you will take this information to heart, figuratively and literally. And at the moment you start feeling like something is off, you won't hesitate, and you get checked out, and you listen to your gut. You advocate for yourself, as these ladies at this table, the smartest women out here, know. For more information, check out the Pericarditis Alliance. That wraps it up for me. I'm Yasmin Vossoughian.